Well, thank you so much for joining us today. My name is Erin Lorandos. I am the Digital Inclusion Library Consultant for the State Library. And today we have with us Alan Schersvig, who is joining us from the Children's Action Alliance. He is a retired nonprofit executive. His last 10 years were spent assisting low-income Arizonans find affordable health insurance. While working for the AHCCCS Alliance for Community Health Centers, he directed a statewide health insurance navigator program, which was funded by HHS, Centers for Medicare and Medicaid. Currently, he's working as a consultant with the Children's Action Alliance to inform people about big changes to access, which is Arizona's Medicaid program. So today he's going to share some resources with us, and we'll be able to share all of those resources after the meeting as well. If you do have any questions while we're presenting, go ahead and drop those in the chat, and I'll make sure that Alan hears your questions at the end. So take it away, Alan. Thank you so much.
Well, thank you, and welcome back from a holiday. I imagine that librarians never get a rest, depending on where you're working at. And I greatly appreciate your work, because I would escape to the library in my junior high and find books that I enjoyed reading instead of all of that assigned stuff. So thank you. So today I'm going to provide information that could be helpful to you or your staff because of questions you may receive from the public. So access return to normal renewal process. Well, what that means quite simply is that all across the United States during the pandemic, state Medicaid agencies, and Arizona's Medicaid agency, we call it AHCCCS, were not allowed to disenroll members during the pandemic. The idea was, no matter what happened during the pandemic, these lower income people should be able to continue coverage and access medical care. Well, during that period of no renewals or continuous enrollment, access grew from approximately 2 million to 2.5 million. And I mean, when you think of the state population being something over 8 million, Arizona has a very large percentage of its population covered through access. Now, access now must renew all 2.25 million members. Now, I'm going to tell you more about that in just a moment. The redetermination process is going to take about 12 months. It started on April 1st. Access estimates that they have 650,000 members that will be directly impacted in one way or another. These are access projections, and they believe about half, or 325,000 Arizonans, could lose coverage because they have simply not responded to access attempts to contact them. Because during this 3-year period of nobody losing coverage, many people did not renew, many people just ignored any kind of contact, and now as access tries to reach them, they're not responding. That 325,000 could include people that have left the state, gotten every other coverage, so they just simply don't worry about access. Now, the other half, about 325,000, an estimate, are at risk of losing coverage because they're no longer eligible. Perhaps their income has gone up, so they no longer meet the income requirements for Medicaid or KidsCare. Perhaps they've gotten coverage. Perhaps they've left the state. So many possible reasons, but based on work that Access has done, they believe about half of this pool of 650,000 are no longer eligible. So there are really two challenges that we are facing. How can you and other organizations help Access KidsCare members retain coverage if they're eligible? And if their coverage is discontinued, how can they find new coverage? Before I get into the hows, let me move to another slide. And there it is. My slide advance is disappearing. I'm going to switch to use the keyboard. So why is it important for kids? I know that you work with adults and others, but it's always interesting to look at how it could impact kids. Children with health insurance do better in school. About 49% of Arizona's 1.7 million children under the age of 19 have access. That's important. 36% of all of the at-risk members are children. So depending on how parents act and react to the information they receive, the phone calls they receive, the letters they receive, we have a lot of children in Arizona that are at risk of losing coverage. Access currently is using messaging that's like this. They're really focused at the moment on update your information. Make sure that your mailing address, phone number, and email address is current. On the bottom part of the slide, and you will receive these slides, you'll receive some other handouts, and we are recording this today. You see the steps that people can take to update their information. They can go to Healthy Arizona Plus. They can call their specific health plan. There are approximately 7 different commercial insurance companies that provide access members with their benefits. United Healthcare, Blue Cross Blue Shield, Mercy Care, and many others. So they have an insurance card, just like you may have an insurance card from employer-sponsored insurance. And on the back of it, there's a phone number. They can work with their health plan, update all their information. And people can also call Healthy Arizona Plus at the phone numbers listed and update their information. So that's what Access is focusing on at this point. One of the things that we are concerned about, we meaning the community that helps people fill out these forms and apply, is that the envelope with this important information will arrive with a return address from the Department of Economic Security. Most people, most Access members, don't know that the Department of Economic Security, or DES, actually does the eligibility determinations for Access. I mean, that's one of those administrative things that people don't understand. We assumed the letter would have a nice Access return address, and we were wrong. So we are trying to get information to people to let them know, look for an envelope from DES and do not throw it away. Read it and take action. There are 4 letters that are being sent out. One is, it's almost time to renew, so update your information. The second letter is a specific request for information. The third letter, you have been renewed, no action is needed. Access estimates that 75% of the 2.25 million people can be renewed by taking no action, because Access has access to databases, federal databases, to check on things like at some addresses and income. So many people can be automatically renewed. The fourth letter is the one that gives us concern. Access medical coverage will stop on fill in the blank for the date, and the date is in the letter. The letter goes on to explain you may reapply for Access. You can appeal to Access the decision that you are going to be dropped. Next option is your information has been sent to the health insurance marketplace. I'll get into that a little bit deeper. Or you can get one-on-one personal assistance if you go to Cover Arizona for help. And if you want help, or if you lose your coverage, you can go to the Arizona Alliance for Community Health Centers and find a community health center near you. Now, in Maricopa County, you might know names like Mountain Park and Adelante and others. If you're in Pima County, Rio, El Rio, excuse me. El Rio is by far the largest, but also there's a very large community health center in Marana. North Country is up in Flagstaff, and there are 23 different organizations that have about 200 community health center sites. Community health centers must offer a sliding fee scale for all, no matter their immigration status, and the sliding fee scale provides people with a discount if they don't have coverage. So, moving on, a little bit about Cover Arizona and the health insurance marketplace. The health insurance marketplace is called many things. It's called Obamacare, and it's sometimes called healthcare.gov. So, if a person receives a letter that says they will lose coverage by a certain date, they are probably being dropped because they're over income for access. Consumers can contact Cover Arizona /connector or call 211 or call the 800 number on the screen. Those actions will connect them with a bilingual licensed health insurance navigator or assister, and these people are certified and licensed to provide help. They sell nothing. They are like being a helper, a friend, and the vast majority of assisters are bilingual, but you can always find a bilingual one. Languages also include certain Asian Pacific languages, and there are other resources available if the assister or navigator does not speak the specific language, including arrangements can be made for American Sign Language. Because 10 years ago, the health insurance marketplace, Obamacare, was controversial, some people looked at it as an option and or heard their neighbors talk that it's too expensive, or believed what they saw online saying it's too expensive. And what's important to know is last year and this year, 2002 and 2023, most people can find coverage for $10 to $20 a month that actually shop and use the health insurance marketplace. For a person that is just a person or a family that is just a little bit over the cutoff for access, let me explain a few more things about the health insurance marketplace. It is commercial insurance offered by United Healthcare, or Aetna, or Blue Cross Blue Shield, et cetera, et cetera. But it's commercial insurance with federal financial assistance. The vast, vast majority that receive or purchase, I should say, their insurance through healthcare.gov receive financial assistance. And there was a significant improvement or enhancement of the financial assistance in one of the post-recession bills. I forget which one it was, but they have changed. That's the important message. If somebody has information that is a couple years old, it doesn't apply. It offers comprehensive coverage. There are 10 essential benefits that were designed to be very similar to what people receive with employer-sponsored insurance. Now, for the person that has had access, they may not be familiar with monthly premiums, deductibles, co-pays, co-insurance, and out-of-pocket maximums. These are all different. And it's important for people to receive help, find assistance that can teach them about how insurance works. Because with access, you essentially pay nothing per month. You have almost no co-payments. You don't have any deductibles. You don't have any co-insurance. It's first dollar coverage. That's not the case. However, the significant financial assistance that is available, particularly for families or people that are just a little bit over the access cutoff, they may get coverage through healthcare.gov for no monthly premium and have significantly reduced out-of-pocket costs. And they would have a much lower out-of-pocket maximum. With commercial insurance, when you hit your out-of-pocket maximum, you don't pay anything anymore. The insurance pays 100%. Now, all of this assistance is based on percentage of federal poverty level, just like many other government programs, whether it be SNAP, TANF, or Medicaid. It's the family income and family size combined to figure out what percent of federal poverty level that family is at, and that's how these financial packages are also calculated. So, bottom line, the less you earn, the less you pay, or the more you earn, the more you pay. It's important for me to share this as a warning, and that is because all across the country, millions of people are having to go through this Medicaid access redetermination process. There are people out there that will try to take advantage of vulnerable people. It's possible that someone may promote low cost and very limited or skinny benefit plans as if they are comprehensive coverage. Let the buyer beware, unfortunately, and they have to understand what is being offered. Qualified health plans are available at healthcare.gov or through the assisters that you can connect with through Cover Arizona. Insurance brokers can and do provide qualified health plans through healthcare.gov and help people qualify for financial assistance. However, some people may even try to sell prepaid medical plans, which are not insurance, as if it is the same as access. In some states, not in Arizona so far, but hopefully that doesn't happen, but in some states, there are reports of phone scams to say, if you pay my fee, I'll get you signed up for Medicaid, excuse me, I misspoke. So in other words, you pay me money, I'll sign you up for Medicaid. No need for that. It's not even legal. People that sign people up for access, assisters that sign consumers up for Medicaid are not paid per head. They're usually paid either by grants or work for an institution that supports that. And health insurance agents, very, very few of them will help people reapply or apply for access. There are some, but they're small in number. We have a resource landing page. When we started this process, it was being called Unwinding Continuous Enrollment. or continuous coverage. So the landing page that we have at Cover Arizona is /unwinding. We have short videos that cover some of the same information I'm covering. We have access to social media posts, some additional details, and that all can be very, very helpful depending on the kind of questions you are asked and depending on how much your particular library sees people that are seeking this kind of help. After today, Aaron will send out a digital and a Spanish flyer that provides the basic steps, the basic information that I am covering today. I'm giving you more background and detail, but these flyers you can print on demand if you download the PDF, or you could have a small amount available if people ask questions. And again, no cost, certified and licensed assisters and navigators, bilingual, are available all over the state to help people. Now, I've told you what I thought was important and kind of the essentials, but I in no means have covered all the details. So let's open it up to have any questions. And I know we have a small audience, so Aaron, you can handle it any way you want, but I hope people can ask some questions. We can add some more information.
Yes, thank you so much. It was great information. I wanted to really thank you as well for the information on scams and how that can be played, because I know, coming from working directly with library patrons, a lot of times we don't hear about it until after they've been fallen victim to it. So it's really good to have that information.
Right.
My first question for you is, if there's one best starting point for a library staff person to just have always in their back pocket, where would you send someone very first? Would it be the Cover AZ connectors? Would it be your website for the information on unwinding? What's that first step?
The first step is to get the consumer to contact Cover Arizona. The website is really resources for organizations. It has consumer information. So that's why I was saying that the 2 flyers, having some of those available pre-printed or print on demand, they were designed just like the most simple thing. Look for the letter, update your information. If you have questions, call. That's as simple as we can make it.
That's good. I love it. And thank you, Donna, for putting that link in the chat. That coveraz.org is where folks would go to get connected to the connectors, the navigators. It's a lot of connecting.
Yes, a lot of connecting, a lot of navigating, and here's that same slide again.
Exactly.
And you could get there from just Cover Arizona or coveraz.org, but if you put in the /connector, then you go directly to it. The other thing, please note that people can call 211. The reason I've put in the 800 number is that the first person you speak to at 211 is going to have to transfer you to one of their specialists. Or if you call the 800 number, you'll get the specialist directly. Saves one step.
That is really helpful. Are there any other questions from folks who are on the call today? And if not, that's perfectly fine. I know a lot of folks come up with the questions after they've had a chance to digest the information as well. So for folks who are pre-registered, I will definitely send contact information to connect you with Alan if you've got any questions as well. I was going to say, I think his last slide has that right there. Did you want to speak a little bit about that coalition group
Sure.
that is meeting?
Yeah, our Unwinding Coalition is very broad. You have community health centers, food banks, several of the health insurance plans, and we share information because if you're one of the health plans, you get information that is a little bit different than the information we might get, and so on and so forth. I should tell you that when a person uses Health Arizona Plus to sign up for access, you can sign up for SNAP benefits, food benefits on the same platform, and you can do just SNAP or just access or both. So that's an important location. And our coalition meetings, our next one, we do one a month, will be in June. We should have some data because Access has created a dashboard. We're having ongoing discussions with them about what they're going to include because they have information, but we're looking for additional information. And it's, like I say, it's 1 hour question and answers. We usually have a speaker from Access or some other organization that's directly involved. And it's just to keep you informed. And once this 12-month period is passed, all the information we're providing is still valid in terms of who do you contact if questions come up.
It's an excellent point too about folks who are eligible for other benefits might be eligible for additional services. ACP also comes to mind.
Yes.
The Affordable Connectivity Program.
Yeah. Yeah. Oh, right. Exactly. Yeah. And again, right now it is a important portal, and Arizona is ahead of the curve compared to a lot of states in this process, as well as the platform that we have.
It's a wonderful resource. Well, thank you so much for sharing all of this with us today. If there's any last minute thoughts that you'd like to share with us, or any additional questions coming into the chat, I'd be happy to forward those along. If not, I really want to thank you for your time today. This was a wonderful overview of the resources that are available. And I'm sure as more people start to get these questions, they'll become even more utilized and more important. So it's good to know who to go to.
Thank you, Erin. You know how to reach me. And thank you all for the work you do, but thank you for letting us share this information with you.
Of course, thank you so much. Well, at this point, I'm going to go ahead and stop our recording.